To the dentist, it's something that we all need to do for not only our oral health, but overall health. Here to share the pros and cons of a dental visit, we have Dr. Kristen Simpson from Simpson Dental. Good morning, great to see you.
Good morning, good to see you.
Yeah, well, let's first talk about dental treatments and the pros and cons.
That's right. Yes, we'll go through some of the more common dental procedures, and I'll kind of give you some ideas of things to think about if you're considering these options, so you'll know the pros and cons to help you make a decision on what might be the best treatment for you. So the first thing is a crown. So a crown is a cap that covers the whole tooth. So it is a great way to build back a tooth if you have a larger filling that's failing or extensive decay in a tooth. It'll help to build the tooth back and get it restored to the proper bite and contacts. So it is a great restoration. It is still susceptible to decay around where the crown meets the tooth, so it still does require maintenance. And of course, a crown is a porcelain material. It could still fracture, so you still want to be careful with what you eat, so you're not going to damage that material there.
Okay. What about a bridge? We often hear that that's something that's needed.
Right, so a bridge is a great way to replace a single tooth. It can be something that's fixed, which means it stays in all the time. So if you're missing a tooth and you don't have enough bone in that area to have an implant, a bridge would be a good way to have a fixed option there. However, it does connect those teeth together. So if you were to have something happen to one of those teeth, you could end up losing the span there. And that bone will continue to shrink away underneath where that missing tooth is. So sometimes you can start to see space underneath it as that bone changes.
Oh, okay. Dr. Simpson, how do we know if we need an implant?
So an implant is a great way to replace a missing tooth. It's a titanium piece that replaces the root of the tooth, and then you can attach on top of it to replace the crown. So it's very lifelike and replaces a tooth to almost function just like a natural tooth. So that really is the best option to preserve the bone in the area and get that tooth back.
Okay, what are some of the pros and cons of veneers versus a removable partial?
Well, so a veneer is a type of cosmetic procedure, which is a thin layer of porcelain that covers the front and the edge of a tooth. So that's a great way to straighten up your teeth. It can give you a smile makeover with having these veneers. Since they are a thin layer of porcelain, you do have to be careful with them. They could fracture, but it is a great way to get that alignment lined up and the color of the teeth where you want them.
Okay.
When it comes to removable partials, a partial is a great way to replace missing teeth. So it's a more cost-effective way to replace multiple teeth since they're all on this one piece that attaches with metal substructure to replace those missing teeth. So that's a great way to get those back teeth back if you're missing them.
Do you still do conventional dentures? Is that still a thing?
Yes, so conventional dentures are a very affordable way to replace your missing teeth. They can support your face and give you some of your chewing ability back. Of course, it's not as much as with implants or your natural teeth, but it is still a great way to get your teeth back in an affordable way. You know, you do have to reline them or change them every 5 years or so because the bone underneath will change, but it is a good option. When it comes to lower dentures, probably will need implants to hold a lower denture in. Lower dentures tend to move around quite a bit, so there are many options with using implants to support dentures, with it either being fixed or removable.
Do you do like implant, like hybrids where you do a little bit of both?
That's right, yes. So a hybrid is using a denture that is then fixed into place. So as long as you can have enough implants to be able to support that, that can be a great option to give you something that's fixed into place. So there are lots of advances and ways for us to digitally be able to do the surgeries and make these prostheses to get great results for patients. So at Simpson Dental, having our lab on site, we're able to get really good results with these procedures.
A lot of great information today, Dr. Simpson. Thanks so much for sharing it with us.
Well, good. Of course. Thanks for having me.